This is an obstructive ultrasound of this is a case of induced abortion. As you can see, this is the uterus in longitudinal section, measuring 9.2 centimeters by 6.3 centimeters. So it's enlarged in anterior-posterior diameter, should not increase 5 centimeters. And this is the endometrial canal with echogenic areas tiny within it. There are shiny echos as well, tiny particles which are more echogenic than the clot or bleed. This is the urinary bladder. This is the cervix, and this is the interior wall, fundus, posterior wall of the uterus. So now this cystic area that you are seeing posterior to the uterus is in fact a corpus luteum cyst of pregnancy, because if we see this corpus luteum cyst of pregnancy is a favorable sign for the maintenance of the pregnancy. But this is a case of induced abortion, and the incomplete abortion, in a sense that the sac is seen within the endometrial canal. This is the endometrial canal. You can see it's dilated up to 24 millimeters, and this is the sac with residual reaction in it. These are the echogenic particles, RPOCs, that you will call as. So this is the corpus luteum cyst being displaced posterior to the uterus, and this is the uterus in transverse section. This is the uterus. This is the urinary bladder. This area, urinary bladder is not adequately filled, is underfilled. This is the transverse section. This is the sac. And this is the echogenic particle, the bleed. Is not as shiny, or calcification is not this much shiny as you are seeing in the view in front of you in this scanning plane. So here you will see that there is bleed along the sac. Now this is the sac, gestational sac with internal echoes, and this is the peri-sac bleed. Now I will show you the echogenic particles. These echogenic particles, tiny and giving posterior shadow as well, few of them are the RPOCs. They are more echogenic than the clot. Then this is a small amount of peri-sac fluid. This is the sac. This is the corpus luteum cyst. So this is a case of incomplete abortion, though induced. This is the arrows are suggestive of particles, the RPOCs. This is the sac. In this section, we are seeing it, and not a complete sac, rather an incomplete sac. And this is the bleed, peri-sac bleed. This is the corpus luteum cyst. हो गया आपका वैसे ही होता है. So this is the uterus, all of this. So this is a case of incomplete abortion with retained products of conception as well as fetal parts. Now these are two shiny areas, tiny particles, which are again suggestive of the same finding. There is no evidence of fluid in the pelvic cavity, and this is the case of our day. Thank you.